The White House announces plans to roll out COVID vaccines for kids ages 5 to 11. That'll begin as soon as possible. The move comes as the FDA prepares to approve the mix and match use of different shots.
We have secured vaccine supply to vaccinate every child ages 5 through 11. And as soon as the vaccine is authorized by the FDA, we will begin shipping millions of doses nationwide. States, tribes, and territories are working to ensure that doses continue to be distributed efficiently and equitably across their jurisdictions. And importantly, we worked with Pfizer to modify the packaging of the pediatric doses to make it easier for pediatricians, family doctors, and other providers to provide vaccines to children.
The rollout of those vaccines will cover some 28 million children. If authorized, the White House says it's launching a national public education campaign to reach guardians and parents with information. To explain more, we're joined by Dr. Purvi Parikh, a pediatric infectious disease specialist and a vaccine researcher with NYU. Welcome to Quick Take, Dr. Parikh. Let's start with what's up with these shots, right? How are they the same? How are they different for kids under 12 than the shots that we've come to know about so much?
Right. So, it's still 2 doses, 3 weeks apart. But the difference is that the dose is much less. So it's only 10 milligrams versus 30. So it's only about 1/3 of the dose, which makes sense. Children will require different amounts of medication, vaccines at different ages.
I'm curious about that because I could see some parents saying, was it too soon to figure out the exact 10 microgram dosing for this vaccine? What do you say back to them about the science behind the dosing changes here?
Right. This is why we do studies in different age groups, because for a child, their immune system is very different at every age. And for children, the studies are even more rigorously checked for safety and for efficacy. So even for adults, the dosing ultimately chosen is always the lowest dose that produces the best response and is the safest, right? So that way we can vaccinate even more people. So, this dose has gone through very, very rigorous studies with thousands of children.
Well, it's a great thing to get as many people vaccinated as possible, but it's already October. By the time these shots get approved, it could be November. And we know that the colder the weather, the more we're pushing kids inside, the more the virus has the chance to spread. I'm a little worried. Are we too late on getting these shots rolled out to kids? Could we see a spike in cases in schools, potentially closures?
Right. The respiratory virus season has already started. So the sooner we can get this age group vaccinated, the better. We're seeing flu, RSV, common cold already spiking. So, it's always better late than never. And still, even in November, it's still early enough where the majority of that winter respiratory virus season will be covered. So I think the timing is still pretty good, and hopefully the sooner the better.
Right. Well, I also want to talk about the virus as a whole because we've been talking about this big portion of the population, right? 28 million, some kids hopefully getting vaccinated. How much of a role is that going to play in our, I guess herd immunity is kind of over now, but how big of an impact could that make in our hope of getting to a less and less COVID-filled world?
It still makes a big impact. Children, can still contract COVID-19. 1 in 5 cases are children. They can pass it on to adults very readily. And what we initially thought about children being relatively unaffected is actually not true. We are seeing kids get very sick, luckily not at the same rates as adults, but we are seeing them in the ICU and we're seeing pediatric deaths. So I think the vaccine for this age group will be a game changer, not just for children, but for our general population as a whole.
Well, let's talk about how the Biden administration is going to get that done. They've said that they're going to really focus on leaning on local health officials who potentially have trust already garnered with parents in the community. In your experience, do you see that being the most effective strategy?
Absolutely. I would go one step further and make sure that those local officials are pediatricians. Children trust their pediatricians the most. Parents trust their children's pediatrician the most. And I've found even when talking to adults, they're much more likely to listen to their primary care doctor than, a public service announcement. So getting it into the local doctor's offices will be key.
So what are some of the big questions that you hear as a pediatric immunologist from parents, and what do you kind of say to get them on board with consenting to their kids getting shots?
Right. As a parent, there is a lot of concerns of the safety of the shots, especially. It's not really the efficacy they worry about. They know that the shots work, but people are worried about infertility, which is absolutely not true. Now we have a lot of data on childbearing age women, pregnant women, breastfeeding women. So that's good news. And then there's a lot of concern around myocarditis from the vaccine or blood clots from the vaccine. And I can't stress enough that your risk for those things are much, much higher with the real virus. So I think with myocarditis, it's almost 16 times higher. So you're actually protecting yourself from that by getting the vaccine. The same thing goes for blood clots. We're seeing so much blood clotting with the actual virus, which is very severe. People are still struggling a year later, and it's much, much less if you get vaccinated.
Yeah, and we're seeing kids have symptoms of long COVID as well.
Right.
And is there anything you want to add to about kids with allergies whose parents might be worried about that?
Yeah, absolutely. I'm an allergist, so I see children with very severe allergies, and there's no contraindication. So, even if your child has severe food allergies or asthma or eczema, they can still safely take the shot because none of those allergens are in the shot. There's no risk in that group. And in fact, it will only protect them.
In our final minute together, I want to talk about potential mandates that there might be at the state and local level for kids to get vaccinated. The White House kind of hinted that they were leaving that to locals today. But according to some polling, those requirements turn parents away from getting the vaccine. 1 in 3 parents of 5 to 11-year-olds planning to get their children inoculated right away were disappointed by those pushes with vaccine mandates. Do you think that those mandates help or hurt?
Yeah, I think they help in a way because it hopefully will instill trust in parents that this is something that is safe, that is effective. Hopefully it will get more people who are on the fence to get their children vaccinated. And this is nothing new. We've had vaccine mandates in schools for many, many years. There's already 11 vaccines that are mandated just to attend school. So parents should look at it in the same way. And unfortunately, this issue has been very divisive, but it really shouldn't be. It's just to protect children.
Right, absolutely. Vaccine mandates have been around for a long time. Dr. Purvi Parikh, pediatric immunologist and vaccine researcher from NYU Langone, thank you so much. We are going to get you some